Well, good morning. How was your night last night?
Oh, my night was terrific.
Can you tell us what you had done?
First of all, you were so good at taking care of my knee. I had terrible knee pain. I could barely walk. It was really difficult, and I was considering taking knee replacement as last resort. But I'm 83, almost 84 in next month. I decided, no, this was not the right thing. It takes a long time to heal.
Right.
And
So
somebody,
how long have you had knee pain?
about 3 years.
About 3 years.
Yes, every year it increased.
It's worse. Yeah.
Yes.
So how'd you find us?
That was a good story because I have some friends. I'm friendly with this gentleman because my partner used to work for him. And so we know him very well. And his wife, she had the same challenge. And she came here and you operate on her. And I could not believe her. She could barely move in the car or walk around. She was like a spring chick. Walking, jumping, getting things from the store. I want that because I've been very active in all my life. I wanted to get back to walking and hiking and trekking and what I have done previously.
So how much pain relief do you have from when you came in yesterday?
Yesterday was pretty bad. I would think if we go by numbers, I think it was 8, 9. Yeah, and today, nothing.
That's awesome.
Nothing.
That's awesome. And you've been exercising and doing those kind of things already. So we encourage you to continue to do that. Overall, I mean, this is a great success.
I think so.
I think so too. Is there anything you'd like to tell people about coming over here to Deuk Spine and Deuk Joint?
I would highly recommend it. Highly recommend it because this is the freedom you have.
Right.
And that's worth to me a great deal.
Right.
I've always been very active and not person sitting on the couch and so on. And I was forced to sit a little bit. And I always think sitting on the couch, starting the sitting on the couch is beginning of the end.
You know, we're trying to educate people that they don't need a knee replacement, that there is a wonderful alternative to that we can do this. Safe travels home.
Okay, thank you so much, Dr. Davis. It changed my life.
We're so happy that you came over and saw us.
Thank you, sir.
And that we were able to help you.
It is the best thing I ever did.
There you go.
Yeah,
All right,
thank you very much.
Thank you. All right.
You.